Hi, welcome to NASN's 2024 virtual conference. My name is Terri Hinkley and I am NASN's CEO. We are so excited to bring this conference to you and are proud of the content we've been able to assemble to help you continue to grow your expertise as a school nurse. Over the next 3 days, or any time in the next 90 days, you can earn up to 20 hours of nursing continuing professional development, or NCPD, specific to school nursing. You'll also have the opportunity to connect and network with other attendees via BrainDate, a platform that lets you connect and discuss topics of shared importance. I'll hope you'll take advantage of this so you can meet other school nurses from around the country. We know that school nursing is often practiced in isolation, so being able to connect with and learn from other school nurses is a true benefit of the conference. And in addition to the NCPD content, you'll see videos recorded by NASN staff and others to tell you about the great work NASN is doing on your behalf. I hope you'll stay tuned for these videos because they'll provide some great information that is directly relevant to your nursing practice. I joined NASN in August of 23, and I spent most of my first 6 months with NASN learning as much as I could about school nursing and the organization. I spoke to every staff member, every executive committee member, and almost every director on the board of directors. And I learned what they think NASN does well and what opportunities we should take advantage of. I've also had the privilege of attending affiliate conferences in New Jersey, Oregon, Wisconsin, and Georgia. I've met some incredible school nurses, all of whom are passionate about and dedicated to school nursing. Through these conversations, I've learned that school nursing is hard, but incredibly rewarding. Coming out of the pandemic, there was an optimism that things could go back to normal, but that's been difficult to achieve. Several nurses have described so-called culture wars taking place in their schools and districts, and how those are impacting their ability to practice according to their scope, available evidence, and role descriptions. I heard from one nurse she isn't allowed to say the word COVID in her school. And another said that she wasn't able to follow the immunization requirements of her state. These culture wars are further contributing to moral distress and moral injury in school nurses, and many are considering leaving their profession. I've also heard time and time again that there's a significant lack of understanding of what school nurses do, even from colleagues and administrators in their schools and districts. Practicing healthcare in an educational setting is completely different from what most school nurses experience during their time in acute care, where everyone understood the important role nurses play. It can be exhausting to have to continually defend your role as an expert in student health, to be left out of meetings that deal with school health or student well-being, or to be second-guessed by other staff, students, or parents. Now, I don't want you to think that all I've heard is bad. I also learned some really positive things about school nursing. I've heard so many examples of the real difference school nurses make for students, school health staff, and the community. Like when we visited Home School in Oak Park, Illinois in September, and learned that their school nurse, Anne-Marie Guerriere, used the school's defibrillator to save the life of a passerby who collapsed while walking by the school. Or when Megan Lozano saved one of her students, Ellie's, life when Ellie experienced a cardiac arrest in school at only 7 years old. Thanks to Megan's clinical expertise, Ellie made a full recovery. Or in South Jersey, where I live, when during a routine physical, school nurse Dori Usinowitz noticed that her student Kira's blood pressure was abnormally high. Kira was referred to CHOP in Philadelphia, where she was diagnosed with renal cancer and had to have one of her kidneys removed. She's now in the midst of a 6 to 12-month course of chemotherapy. There are so many stories like this around the country. Every single day, school nurses are making a difference. You are making a difference. And NASN is here to advocate for school nurses because you do make a difference. So I want to take a minute and share with you, because I think it's important for you to understand what we have identified as the top priorities for NASN to address over the coming year and beyond. Broadly, these three priorities can be categorized as workforce, funding, and data. And I'll tell you a little bit more about each of these. And while I've categorized these separately, you'll see as we dive into them that they're all linked together. They inform each other, and they really can't be addressed in isolation. NASN's first priority is related to the school nursing workforce. Workforce is an umbrella term and really quite broad. In the context of school nursing and NASN, when we refer to workforce, we're talking about anything impacting the availability and retention of school nurses, whether that is scope of practice, credentialing requirements, compensation, staffing, or models of care. NASN's position is that every student deserves access to a full-time registered professional school nurse all day, every day. We define this registered professional school nurse as a BSN prepared RN. However, we acknowledge that each state sets the requirements for school nurses, and there is significant variability between and among the states. Not every state or district has the same staffing models. Some states have a school nurse in each school, while others have a nurse responsible for overseeing LPNs or LVNs, or even unlicensed staff across multiple schools. And unfortunately, 8 states don't require school nurses at all. We also know that there is significant variability in how school nurses are compensated across the country, with some having parity with teachers and educational professionals, and others being compensated to support staff. NASN is committed to gathering the necessary evidence on the models of care that benefit students and contribute to their ability to be healthy, safe, and ready to learn. Once armed with the evidence, we can educate and advocate with legislators and administrators on the models of care that contribute to student safety and well-being. We can recommend evidence-based models of care and staffing levels. We will have the necessary data and outcomes to influence decision-making at the local, state, and federal level. NASN also asserts that school nurses should be appropriately compensated to ensure a pipeline for recruitment and retention. We must be able to attract school nurses to the specialty, and to ensure we have a diverse workforce requires that we compensate school nurses based on their education and clinical expertise, and recognize them for the expert clinicians that they are. According to NASN's 2022 school nurse workforce study, only 34% of school nurses earn at least $60,000 annually, compared to 70% of the broader nursing workforce. It is unacceptable for highly educated, qualified registered nurses to be compensated at some of the levels school nurses in this country are being paid. If we are to have sustainable nursing workforce, we must have pay equity with other nursing specialties. Lastly, school nurse well-being is an important component of our workforce priority. I mentioned earlier the challenges that frontline school nurses are facing in their schools every day. We must ensure that school nurses have the support they need, the resources they need, and that they are safe at school. NASN's commitment is to optimize the work environment for school nurse well-being, professional impact, workforce diversification, and practicing at the top of school nurses' scope of practice in alignment with NASN's school nursing practice framework. Our second priority is securing sustainable funding for school nursing services so all students have access to a school nurse and school health technologies. According to our workforce study conducted in 2022, 23% of schools across the Midwest and Western U.S. have no school nursing services, compared to 3% of schools in the Northeast and Southern U.S. These differences lead to significant inequities for students. Some of our most vulnerable students who need us most have no access to school nurses. NASN strongly believes that these inequities must be corrected and all students must have access to school nursing services. Without funding, we won't be able to achieve our workforce goals and address the ongoing inequities in access that are occurring across the country. As I've mentioned a couple of times, our workforce study was conducted in 2022, and we did see a really interesting finding. The number of schools with a full-time school nurse increased to 65.7% or 66% in this study, while in our previous workforce study from 2016, the number of schools with a full-time school nurse was only approximately 40%. Much of this increase has been attributed to ESSER funding made available during the pandemic. Those ESSER funds are now coming to an end, and I am hearing from school nurses across the country that their positions are being eliminated as a result. Medicaid expansion of coverage in school health services is one example of sustainable funding for school nursing services. And NASN is partnering with the National Alliance for Medicaid in Education, or NAME, and Healthy Students Promising Futures to increase access to Medicaid funding for school districts and states. However, to advocate for sustainable funding and a robust school nursing workforce requires data and evidence on the difference school nurses make in children's health and well-being, which leads me to NASN's third priority, data and outcomes. NASN is committed to building evidence of school nursing's contribution to student learning, health, and the overall school climate, and to facilitate the uptake of school nursing-related evidence into practice. For example, when I was talking a minute ago about the workforce, it was more impactful because I was able to use data about the number of schools with full-time school nurses and the change over time, as well as salary data. In doing so, I presented evidence to validate the message I was sharing. We must be able to articulate and quantify the difference school nurses make every day, using language that resonates with educational administrators and leadership. At every opportunity, Kim Stanislow, NASN's Director of Research, Education, and Practice, reminds us that we must speak the educator's language to ensure our value is understood. We have data from 2 studies conducted in large districts in 2 different states that demonstrate that school nursing had a positive return on investment. In a study conducted in Boston, for every $1 spent on school nursing, society gained $2.20, and in another conducted in the Midwest, the gain was $1.67. Several studies have demonstrated positive correlations between school nursing and absenteeism, time in class, management of chronic conditions, immunization compliance, EHR and emergency record completeness and accuracy. These data demonstrate the value of school nurses and we must amplify and share these data to advocate for school nursing services in every single school in the country. Sharing this data with the public, educators, administrators, legislators, and partners is critical and is an important component of our advocacy efforts. NASN is committed to encouraging and funding this body of research and sharing the results while educating key partners and collaborators. I'd like to thank you for attending NASN 2024's virtual conference. I hope you enjoy the sessions and the brain dates, and I am always available if you have any questions or concerns that you would like to share. My email is on the slide. It's thinkley@nasn.org, and I encourage you to reach out anytime. It is my honor to serve as NASN CEO, and I look forward to working with the board, executive committee, volunteers, staff, and our external partners to continue to advocate on behalf of school nurses everywhere. If you are a member, thank you for your membership and commitment to school nursing. If you're not yet a member, I hope you will consider joining us and becoming part of the change we are committed to making. Thank you.